Thank you very much, Dr. Salto Tellez. Our next speaker is my friend, Mitch Schnall. He's the Eugene P. Pendergrass Professor of Radiology at Penn and Chair of the Department of Radiology at the Perelman School of Medicine. Mitch.
Thank you, Kojo. I'm going to try to give you a little bit of perspective on some of the thinking that we've been doing at Penn relative to integrative diagnostics and try to make the case that, frankly, there's a great opportunity for pathology and radiology, I think a need for pathology and radiology to collaborate strongly around this issue. You know, we've talked a lot about precision medicine here. Precision medicine is really driven by diagnostics, right? The proliferation of diagnostics over the last several decades that allow us to create subpopulations within populations and determine optimal treatments, right? It's all empowered by the proliferation in diagnostics that we've seen, you know, over the last several decades. This is a slide lent to me by Mike Feldman, a pathologist formerly at Penn, now the chair at Indiana, you know, pointing out that, you know, something that we've talked about several times here today, right? Diagnostics tends to be isolated in silos and silos within individual disciplines. And frankly, there are as many silos within our disciplines of radiology and pathology than there are across the disciplines of radiology and pathology, right? We've heard already some of that today. And they span the entire length scale from, you know, centimeters and meters all the way down to angstroms in terms of the scales that we work at. And one of the challenges that we face is how do we put all this information together and make sense of it, you know, with respect to the patient. And I think that as we think about, and this vision has been talked about multiple times today, as we think about diagnostics, you know, diagnostics traditionally has been an art, part of the art of medicine, an individual who was a bit of a sleuth. I was tempted to put a little bit of a Sherlock Holmes figure here, sort of looking under the sheets and looking under the rocks and gathering information and aha, we've got a diagnosis. Certainly if you watch the TV shows, that's how it all goes down and that's how diagnoses are made. The challenge is now there are so many inputs, real inputs and potential inputs, that it's really not sensible for an individual to be able to take these inputs and integrate them and come to a conclusion. And so the idea that we've got these inputs entering into a system in our society, one of our societies, we've coined the term the diagnostic cockpit, you know, sort of bringing information and processing it together and providing actionable interfaces to the pilot, so to speak, the person flying the plane, taking care of the patient. And so that's our aspirational model, right, is to have diagnostics as a data-driven exercise, not necessarily as an art form. Truth be told, there's always going to be some art in diagnostics, right? There's always going to be some humanism in the patient and some understanding of their situation. But clearly, we've got to drive much more data science into our diagnostic processes. And I'd like to make the case that in order to put this together, it would make the most impact to have the two largest disciplines that focus on diagnostics work as partners, and I think there's a lot of rationale for that. There clearly are other parts of medicine very involved in diagnostics that are going to be part of this, but I think radiology and pathology clearly are the largest diagnostic disciplines. I also like to think that radiology and pathology have complementary expertise. The pathologists are experts in biology. Radiologists tend to be more experts in large-scale anatomy and physiology. The pathologists are very good in informatics and ontologies and classifications. Radiologists know how to push pixels around, right? We know how to push big data files, store them, move them around, get them to where they need to go in terms of, and at some level, put analytics layers on top of them. Radiologists are pretty good at workflow. They know how to move patients in and out of clinics. Gary and I were talking about, we move 5,000 patients every day at Penn in and out of radiology equipment. And we know how to do that effectively and efficiently. the pathologists are really expert in quality systems, and radiologists have more or less ceded this to, over historically, to being a physics measure of the quality of image coming from an instrument. That's becoming less and less what we need to be doing as our instruments are becoming more and more empowered themselves with analytics, and as they're starting to produce actionable results on the back end. We need to be thinking about quality systems, CLIA-like processes for our radiology instruments, and we don't know how to do that. The pathologists know how to do that. In fact, I've been knocking on doors of our pathologists asking questions about how to do this for years now. And so at Penn, we've gone down the road of working together and trying to imagine what a partnership could look like. I don't know whether this speaks to how valuable this effort's been, but most of the partners that I've started to work with are no longer at Penn. They've either retired and moved on, including one of our moderators here. But these are some of the strategies that we've spoken about. We've spoken about strategies around research, building a joint data science program, focusing on image analytics and overall diagnostic analytics. I think actually thinking about diagnostic outcomes and how to value diagnostic outcomes is a legitimate question that I don't think is well answered. The traditional cost effectiveness models, I don't think do us service, and to think uniquely about how we value diagnostics, I think is important and is a common problem across radiology and pathology. And then developing combined multimodality diagnostic systems is something we think about. We think about harmonizing our systems, a single medical record system. Haven't quite got the pathologist on Epic yet, but hopefully that'll happen in the next year. But we are actually on a single PACS system now, as I'll show you. And creating a diagnostic decision support system for order entry, what's the next test, following diagnostic pathways. Education, how do we dip our toe in the water of starting to create cross rotations? I'll tell you, one of the most informative things for me in the early days of MR, we had no idea what we were looking at. And so I used to go to the operating room, take specimens, go down. I spent a ton of time in the gross lab, right? And grossing in specimens with the gross techs in order to optimally set them up so we could figure out alongside the pathologist what we were looking at. This was incredibly informative for me, really made me a much better diagnostician, and how do we create those opportunities for people. We're starting to think about joint clinical activities, developing diagnostic pathways together, a diagnostic consultation service, and starting to think about co-locating, particularly as we go more digital, co-locating some of the pathology and radiology services. One of my pipe dreams, and Mike Feldman and I talked about this quite a bit, is let's put the breast pathologist and the breast radiologist in the same room. I bet re-excisions for atypia would go down if they could interact in a seamless way together. And then some integrated activity, things that are low-hanging fruit, results communication. We both share this problem. Again, decision support and providing access, IT, billing, marketing, these are things that we could do together as a group and be more effective at it. Just to show you examples, this is our shared PACS system. If you look into PACS, you can see CT, MR, and here's a gross picture. We have not as much histology yet, but we're starting to get our scanners running. Sitting right in the PACS, just looks like another modality, directly accessible, and you can put side by side a CT scan and a gross picture here, and the histology as well. This is a center that we developed, the Center for AI and Data Science for Integrated Diagnostics. This is a joint center focusing around some of the problems that we heard about today, co-directed by a faculty in radiology and a faculty in pathology. We've had co-recruited faculty now, and you can see they must have adopted that little cockpit model in their thinking about what their goals are as a center. And so, in summary, I think it's critical to precision medicine. I think we have a lot of similar operational and clinical challenges in radiology and pathology that can drive a natural partnership. We use complementary approaches that I think could also empower us by working together. And I think personally that we ought to drive stronger and stronger partnerships between the disciplines if we're going to make this a reality. Thank you.